Welcome to Mededia. This is Tariq. So we're going to do another mock interview of one of Mededia mentees. We have Dr. Nayab Bangash here. Let's start with the formal interview. Dr. Bangash, please tell me a little bit about yourself.
Sure. I'm an international medical graduate and an aspiring pediatrician from Pakistan. I'm also a former pediatric resident from Children's Hospital Lahore, which is actually one of the largest pediatric hospitals in Pakistan. So I moved to United States almost 3 years ago, and I've been living in New York City with my spouse since then. And I also have a 19-month-old who just keeps me on my toes. In my free time, I like to play pickleball over the weekends and love to do cooking and love to invite people over for dinner. And currently, I am working as a remote research volunteer with one of the teams at Stanford University for the Pledge to Rise movement. And my future goals are to become a well-rounded and exceptionally trained pediatrician. Therefore, I am really excited to join your program.
Okay. Thank you. Thank you for that. And so tell me a little bit. You said you like to cook. What do you like to cook?
Yep. I love to cook Pakistani ethnic foods. It's something that my mother used to cook, and it was delicious. So that's something I like to practice myself as well.
So can we anticipate residency get-together at your place in future?
Yeah.
Okay. How many people have you cooked for? Maximum number of people at one time?
Maximum, there were like around 20 people. It was in the month of Ramadan when people fast like throughout the day, and like we have like a little feast over for the dinner. So that was something I made
So tell me
a
a little
large
bit about
quantity.
Ramadan. I've heard about it. So briefly tell me, what do you Muslims practice during Ramadan?
So Ramadan is a very holy month for Muslims. It's the month where you kind of like purify yourself, not just physically and spiritually. So in Ramadan, Muslims are supposed to fast and not eat or drink from the dawn up till dusk, which is on average is around between 12 to 16 hours. And that's the time it teaches you about being well controlled and patience. So it is like for like 29 to 30 days, and it's a really good practice.
Okay, thank you, thank you. So I see you graduated in 2015. So what have you been doing since then?
So I graduated in 2015, and right afterwards, I pursued my passion for peds in Pakistan at first. I did my house job, which is an intern year, and then 2 years of residency training in Children's Hospital. Afterwards, I decided to move to United States with my spouse, and that's when I still was obviously very passionate about becoming a pediatrician. So I pursued my USMLE journey, and I really tried to familiarize myself with the US healthcare system and took all my USMLEs. And also, I was raising my kid as well at that time.
Okay. So what prompted you to move to US?
That's actually a very good question. I would say I'm a very ambitious person. So I wanted to grow both personally and professionally. And since this world is like a global village, so why not go for the best? So, I decided to, with my spouse, that I think since we are both ambitious and there are like great number of opportunities for both of us, so it's good that we will move to US.
Okay. What do you think is your biggest strength?
My biggest strength would be I'm very adaptable. I have adapted myself in various workplace settings and with different people. And also I have like settled myself in a completely different society. And that's something I'm really proud of.
Something about you that you're not proud of?
That's a very good question. I would say that I do have like a little bit of imposter syndrome, and that's something I'm working on. Because I remember there's a time when I was sending emails to some of the attendings for clinical rotation, and one of them was Dr. Bise, who is the chief of child neurology department. at Robert Wood Johnson, where I did my observership. So he really appreciated my achievements. I couldn't believe that. Are you really talking about me? And that was the time I realized, like, I really need to work on it and give myself some credit, because success doesn't necessarily comes with perfection.
Interesting. Um, what's your definition of success?
Um, Success is about being happy, I think. It's like, it's not just it doesn't have really one dimension. It's about being, uh, having a really purposeful life and having, being like satisfied with your own job, and at the same time having a healthy relationship with your friends and families. So that's like, it has different aspects, and at the end, if you are happy with your life, I think you are successful.
So purposeful life, you said, is very important for happiness, right? So,
Yeah,
what's your definition of purposeful life? What's your purpose in life?
it's very clear actually. I would say that it's I wanted to be a physician, and particularly pediatrician, because when I was working in the hospital setting, that was the time when my patient really moved me. There were young kids who were like suffering from uh, horrible chronic diseases, and they were so young, and they were not like, they didn't even know what they were going through. And that was something that I really felt, and I felt like, okay, I can spend most rest of my days taking care of these kids.
Okay, interesting. So, why peds? What made you passionate about pediatrics?
Actually, that's a very interesting question. So for me, my love for pediatric didn't grow over a rotation. It's been throughout my life. My father is a pediatrician. I watched him taking care of his patients, and that was something inspiring for me. And I always saw that how important he is for the families, as a physician, as a pediatrician. So afterwards, when I was in med school, I noticed that how diverse this specialty is. It not only has like infectious diseases or chronic diseases, it also have congenital diseases. That was something very interesting for me as a subject. And then when I moved to the clinical side and started working in a hospital with children, that was the time when my love grew deeper for these kids, and I really, like I said, I really felt for them, and I felt like I can take care of these kids for the rest of my life. And also, I love those tiny little feet, and I love to play with them. So that's why I love
Okay,
feet.
interesting. Cool. So, I see you have been working at Stanford University for a RICE initiative. Can you tell me a little bit about that? What you're doing, what's your role, and what is this initiative?
Sure. So RISE stands for Research with Inclusion, Social Justice, and Equity. So it's a movement for involving of the underrepresented population in the United States in the field of research. So right now I am working as a research volunteer and writing a literature review on the health disparities faced by the MENA population, which stands for Middle Eastern and Northern African population in the United States. Um, why I am focusing particularly on the population is because they are not even considered as an ethnicity in the United States census. They are considered as labeled as Caucasians. So that's why this movement is trying to help in them getting their own identity.
Okay. So, when you say we are not considered an ethnicity, what do you mean by we?
No, I said MENA population, Middle Eastern and Northern
Middle Eastern.
Africans.
Okay. Okay. Thank you. All right. And I see you have worked in New Jersey and New York. You've done
Yes,
multiple rotations in all these areas. If you have to
yes.
pick one rotation among these, which one do you think is your most favorite one? The one where you had the best time and learned the most, and why?
Um, okay, that's a tough one. Because I was here for acquiring United States the healthcare system familiarity, and each one of these rotation helped me to do that. But I think if I have to choose one, I would go for the pediatric intensive care unit where I rotated in SUNY Upstate Walisano Hospital. That was just a really fun time, and not just a fun time, and I really had like a closer look at the inpatient settings, and I personally like the ICU settings, and I enjoy that.
Interesting. Okay. What's your definition of social justice in medicine?
Social justice, I would say it's, you have to like provide to the populations, and I would say that it's not about just the equality, it's the equity. And all these population, you have to like look for that why they are suffering from these disparities, and you really have to address them. So that's why what my work is, I'm like actually like working on what are their health behaviors and what is actually leading them to suffer from these disparities. So social justice will be like addressing these differences, and then that's when we will have like a social justice.
Okay. What is one thing that irritates you or annoys you?
uh, that's a good question. I would say, having there is my pet peeve. I would say that nail biting. That's something really annoys me, and that's something. That's it.
Okay. All right. Where do you see yourself in 10 years?
uh, in 10 years, I I see myself. Although I know I know that no one can predict what happens in 10 years. But if I have to picture myself, I like to picture myself. Uh, Getting up in the morning, going to work, and and I have figured out what I'm exceptionally good at, and do that in taking care of my pediatric patient. That's something I'm really hoping for in 10 years.
So we have close to 2,000 applicants and we interviewed 300 of them. What sets you apart from all of them and why you should be selected among them?
So I would say it's not. Uh, Obviously, all three of them have worked really hard, and it's not that anyone is superior to another. Right? It's just that each one of them is unique in their own way. So for me, what makes me unique is my journey, my experience working as a resident, and because residency not only teaches you about pathologies management, it teaches about various skills that are required in a stressful situation. So I feel like I was very fortunate to learn various skills like being well organized and efficient. At the same time, I know how to keep my nerves in control. And I have also found that I learned about myself that I'm a really supportive co-worker, a team worker, and I really bring positivity at my workplace, and love to, even I am really okay with the feedbacks.
Okay. All right. What's your favorite thing about US healthcare system?
My favorite thing about US healthcare system would be having an interdisciplinary approach, and at the same time having an evidence-based approach, because that's something that even a very complex diseases are managed very efficiently. And I was really impressed by many of the teams that were working in the hospitals and taking care of extremely complex cases and having really poor prognosis and at the time, but still they were like able to deal with the diseases. So that's something really impressive for me.
What's your favorite thing of Pakistani healthcare system? Something that is not present in US healthcare system.
So it's very, in Pakistani healthcare system is actually free for those who are not able to afford, and that's something I think it's really required, especially in people who are living below the poverty line. So that's, and they are able to get their surgeries and MRIs and all these expensive investigations without even paying a single dollar. So that's something really impressive about Pakistani healthcare system.
Very impressive. So, what's one weakness, one bad thing about Pakistani healthcare system that you wish you could
So
change?
I wish I could change the, I would say that accessibility. because of having like providing a free healthcare system comes with a drawback of having limited resources. And because there are because like I worked in a tertiary care hospital in a city which was actually covering for more than like 100 miles of radius, and that was something and there was a huge patient influx because of this. So that's why you really need to like work on providing resources uniformly throughout the state.
And what's do you think is the biggest weakness of U.S. healthcare system?
So I'm not an expert about this topic, but I think what I read and understood, I would comment a little bit. And also based on my own experience, it's quite expensive though. I was reading once. I was reading that there like some families in United States go through bankruptcy every minute. So that was some really horrifying fact for me to read. So that's something I would say that people should work on.
Okay, cool. If you're by yourself on an island and you are allowed to take three things, what three things are you going to take?
Can I take my baby with me?
Sure. Okay, three things in
Oh,
addition to your baby. And don't
three
take
in
baby
addition.
supplies with.
Okay, okay. That's what I was going to say. Um, hmm, my cell phone, and also I would like to take. That's a good question. I can take maybe like mosquito repellent. Maybe I'll be needing that on the island, and also a bottle of water. I might get thirsty, so we need them. Yeah,
Interesting. Okay. So you can't live without your cell phone?
I might need to call someone if I get bored. So
Okay. Interesting. Interesting. All right. Well, good luck. Was very nice interviewing you. Do you have any questions for me?
Thank you, Dr. Tariq. I do have two questions in mind.
Yeah.
I wanted to know, what do you think is the quality of a good resident?
Um, I think there are two. I can't say that there's only one quality. Both are equally important. Number one is teachability, how teachable you are. If I'm telling you something, are you listening? That is, you should be not only listening, but acting upon it. So you should be a good listener. If I'm telling you that you did this mistake and I tell you to fix it, you incorporate that in your practice and don't repeat it again. If I have to tell
Mhm,
you the same thing 5 to 10 times, then you're not very teachable. You
oh,
should fix something when I tell you first, max second time. Nobody should tell you the
mhm,
third time, preferably not even second time. You should listen very
mhm,
actively to what's the feedback you're getting, which takes me to the second one, ability to take negative or critical feedback, how open you are to take feedback. See, it might seem easy or natural, but it is not for supervisors to give feedback. And you will also
mhm,
realize this at the end of the day. Most of us are at our core good human beings. We don't like to uh, give negative feedback to anyone. We don't enjoy that process, but it's a necessary process that's required for growth. So some people get very uncomfortable with that. They're not naturally comfortable giving negative critical feedback. At that time, if you start acting a little hostile or awkward or upset, that makes the other person a little more upset or awkward as well. And uh, the entire conversation becomes very awkward. So we want people who want to grow, because that is the only way you grow, by pushing your limits, by knowing your deficiencies. If we are not telling you what your issues are, you're not going to improve. So ability to take critical feedback and teachability.
mhm.
Once you are good at accepting negative feedback, then you will act upon it, you will try to improve, and that is how you become more and more teachable.
Okay.
Okay.
I think
Any other
I'll
question?
keep that in my mind.
Thank you, Dr. Bangash.
Yes, actually, I have like now that I have a chance, I wanted to discuss, like ask a question. I read
Sure.
one of your articles where it was regarding the fourth dimensional knee MRI for
Yeah.
the pediatric patients. So,
Mhm.
how did you come up with that idea?
I'll be honest, it wasn't my idea. It's something that is being continuously worked on. I was a research fellow at Stanford, and what they were trying to do is try to bring down the imaging acquisition time significantly, because a lot
Yeah.
of times our patients had to be intubated, put under anesthesia to get an MRI. So the imaging acquisition time was ranging between 40 to 60 minutes. So what we came up was this, do you know what the fourth dimension is?
No, that was the first time I read
Yeah,
about it. That's why I'm
the
really
fourth dimension is
interested.
time. For example, if you're doing cardiac imaging, you're imaging the heart in across the entire beat, the entire cycle, from systole,
Yeah.
diastole, back to systole. So that's the fourth dimension. So you can look at
Mhm.
one image, one axial slice or coronal slice or sagittal slice in 20 different, we get 20 different images of the same area.
Mhm.
And those
Oh.
20 images show systole to diastole. Let's say systole is like first 7 images are of systole, then the 13 to 14 images are going to be of diastole. So that's the
Mhm.
fourth dimension. So
Mhm.
the whole idea is that we do volumetric imaging. By volumetric imaging, I mean is like, when, I'm sure you must know this, when you're sitting at a scanner, you're acquiring images that are in axial slices. You're cutting the patient.
Yeah.
Those slices could be axial. Those slices could be coronal or sagittal as well, but mostly axial. In volumetric imaging, you're not acquiring axial or sagittal coronal slices. You're
Mhm.
acquiring data of a whole area, let's say the head or the heart or
Mhm.
the knee.
Mhm.
Then
Mhm.
what you can do is you can reproduce any slice in post processing. So you're just acquiring the
Okay.
volume, and from that volume, you can reproduce a coronal slice, sagittal slice, or axial slice, or even oblique slices. So that's
Mhm.
where it really saves a lot of time. Let's say for cardiac imaging, you need multiple, sequences at multiple different angles. In the 4D imaging, you're requiring the entire volume, and then you can rotate that image, move it around, and set up
Yeah.
any oblique section that you want to see. So post processing is a lot. 4D flow or 4D imaging is very heavy on post processing. Most of this
Mhm.
reproduction of the images happens on the post processing, but the acquisition time is significantly less.
I think it's really important because especially for the younger kids, it's not really easy to keep them in a place. So that's really
Yeah.
a wonderful idea.
Thank
Thank you
you.
so
Thank
much.
you much. You're most welcome. Do you have any other questions for me, Dr. Bangash?
Yeah, I guess that's about it. Thank you for answering
Okay.
all my questions.
You're most welcome, and good luck for the match. It was nice meeting you.
Nice meeting you as well. It was a pleasure to be here.
Thank you. All right, Nayab, feedback time. You did very good. Very good.
Thank
What do you
you.
think? What do you think how you did?
I think I did. I hope I didn't sound nervous. I wasn't fumbling, and that's it, I suppose.
No, you didn't seem nervous. I think
Mhm.
you did very good.
Thank you.
So let me pull up my notes. What I get. Okay. So just see, I have to give you some feedback. For
Yeah.
me, it was a very close to perfect interview. You did very good. It seemed like I was talking to somebody who's well read, well educated, somebody who takes her time answering questions and tries to answer them in the best ability possible. So that was all very
Mhm.
good, very impressive. It's good. You're doing
Thank you.
very good. A few things, just because I have to give you some feedback, it's not the end of the world, and it's not like big deal breaker for me or anyone.
Mhm.
But I have to give you
Mhm.
some feedback, right, for something to improve. It's not by any means perfect. There are little things you can work
Mhm.
on.
Of course.
Your smile was inconsistent. What I mean is you were smiling 90% of the interview, but I think when I
Okay.
asked you a couple of challenging questions, your answers were phenomenal. But at that time, I saw your smile go away. Similarly,
Okay.
yeah,
Okay.
similarly, your eye contact was a little inconsistent. I think you weren't
Mhm.
looking into the camera that much as you were looking into the monitor, and that is natural.
Yeah.
We're not used to looking at the camera and talking. Just that it makes a little bit of difference, very minor difference. When you're taking an interview,
Mhm.
try to look into the camera rather than in the person.
Mhm.
I know in the
Okay.
past interviews, Rafi was like he switched off the video, because the video, when
Oh.
you looked at the video, like you're distracted. So he just had a white sheet on the monitor, and he was just looking at the camera. I don't know if that's the right approach, because you don't really see the interviewer and you don't catch the visual clues. But what I do is I actually minimize the video and put it right next to where the camera is. So I'm naturally looking
Okay.
there. So I'm looking close to the camera, but not looking into the camera. But that was again a small thing. And last thing, that you could work on, and you didn't do that a whole lot, but like I think max 3 or 4 times in the entire interview, you had unfinished sentences. So you were
Okay.
saying something, and then in the middle of a sentence, you're like, okay, you jump to the next sentence. And I understand you're nervous. Sometimes you're a fast thinker. You're thinking about something else, but saying something else. It can happen. Take your time. Try to finish your sentences. Not a deal breaker,
Okay.
not a huge deal, but these are some of the finer tweaks that you can do to your interview. Other than that, it was very nicely done. Very good interview.
Thank you. Thank you so
Good
much.
luck for the
I'll keep
match. Do
these
you have any
things in mind.
questions?
I guess that's it. Thank you so much.
Okay.
It was really amazing.
Good, good. All right, everyone. I hope you learned something from this mock interview. If you did, please like this video, share it with others, and subscribe to the channel. And like we always say, never give up, never lose hope. Bye.